During the height of the pandemic, the government declared a healthcare emergency that is set to expire soon. Joining us today is Dean Cameron, president of the National Association of Insurance Commissioners, to discuss the big impact this will have on health insurance. Welcome, Dean.
Hi, Desiree. Glad to be with you.
Yeah, happy to have you on. So why is this issue so important right now?
So the public health emergency was started during the pandemic, and it gave extra benefits, extra subsidy to some of our citizens. That was set to expire tomorrow, but now has been extended until January 11th.
What effect would the emergency ending in January have on health insurance coverage?
So on January 11th, assuming it's not extended again, they will take a look at your individual situation again, and you may lose coverage, or you may lose subsidy if you were obtaining that, or you may be kicked off of Medicaid. And so now is a great time to review your situation because it's open enrollment season. The annual open enrollment period for seniors starts on October 15th. The annual open enrollment for those under 65 starts on November 1st, and that's the opportunity to review the plan, your current plan, and to review any other options that might be yours.
That's good to know. And Dean, how can consumers protect themselves against misleading advertising around Medicare and Medicaid and ensure they're getting good coverage?
So for a general rule of thumb, if it sounds too good to be true, it probably is. Yeah. There's no such thing as a limited time offer, or if you call now, we can give you a special discount, or that we can that we can refund money. These are highly regulated products. We'd recommend working with a local agent, someone you know and you can trust and that you can reach out to. If you don't have a local agent, then work with your state's senior health insurance benefits advisor or your health insurance assistance program, or reach out to your Department of Insurance. Your state's Department of Insurance is there to help you navigate these incredibly confusing waters.
Yeah. And with open enrollment, what questions should consumers ask when they're considering purchasing a healthcare plan?
So the first thing I want to ask is, what are my prescription drugs? And what are the doctors and the hospitals that I'm using? And are they covered the same under my current plan as they were previously? Because the plan can change. So you might have a prescription that you were taking, you think you're fine, and all of a sudden now you're paying more out of your pocket. So I want to look and make sure that my current plan or any other prospective plan is covering those drugs and is covering my doctors. Secondly, I want to look at cost. Not only the cost of the premium, but the cost of the actual benefits, the deductible, the co-insurance, the co-payment. You want to make sure that the cost of those things combined fit within your budget. Sometimes the cheapest plan isn't always the best plan, and you can get a plan that pays for those benefits even better. So those are the things I want to look at as I'm reviewing my plan.
And if people receive a surprise balance on a health care bill, what should they do?
Well, the first thing you would do is go back to that doctor or that hospital, because under the new federal law, they're not supposed to give you a surprise balance bill. And so go back to them and say, hey, fix this for us. And if they refuse to fix it, come to the State Department of Insurance, come to your California Department of Insurance, where they will reach out and address it. You can also go to the federal government if you desire, or you can go to NAIC.org to find out information.
Dean Cameron, thank you so much for these very helpful tips. And like you mentioned, for more information, visit NAIC.org.